As part of reducing postnatal opioid exposure, the Chosen Collaborative aims to increase infants' exposure to human milk. Promoting breastfeeding when medically safe for the infant has been shown to decrease neonatal abstinence symptoms. The Chosen Collaborative's approach for safe breastfeeding in the setting of maternal substance use is based on recommendations from the Academy of Breastfeeding Medicine and the American Academy of Pediatrics. The Chosen Collaborative encourages hospitals to adopt a policy on the safe use of mother's own milk and offers sample resources to support policy development. Sample resources include a comprehensive breastfeeding guideline to assess safety for breastfeeding, which includes maternal history of both licit and illicit substances, consideration of other prescribed medications and dosages, and infectious risk factors, a lactation consult template, and examples of how to stratify responses to lactation education and support for families based on current patterns of use and treatment are also provided. As part of their policies and procedures, many Chosen sites ask women who are interested in breastfeeding to complete a breastfeeding checklist. This completed checklist is then used to determine next steps for supporting breastfeeding and/or maintaining milk supply. The checklist asks if women are in a supervised treatment program for 90 days or under the care of a physician for prescribed opioid treatment, have been sober for 60 days or more, are planning to continue drug treatment after the birth of their baby, have a negative urine toxicology testing for other substances at delivery, consent for toxicology testing of their infant. If women answer yes to the above questions and have isolated opioid use under the care of a physician, then hospital lactation teams support immediate breastfeeding. If women answer no to any of the above questions, hospital lactation teams support the maintenance of mother's milk supply and provide formula for infants while working with women toward becoming drug-free. With consent, hospital healthcare teams work with a woman's treatment providers, including medication-assisted treatment providers, to help continue a family's journey toward health. Mothers who are in a supervised treatment program or mothers who are under the care of a physician with chronic opioid therapy may have their medications adjusted in the weeks following birth. It may be important to consider how changes in medication dosing and regimen may affect breastfeeding. The Chosen Collaborative recommends discussing this possibility with women, where a consent to release information will allow healthcare providers for mother and infant to communicate regarding safe breastfeeding practices. While the provided resources support this kind of stratified response, participating hospitals are invited to adapt the provided tools for their own context. The Chosen Collaborative encourages educating women early in their pregnancy regarding safe breastfeeding in order to support their goals after delivery and to optimize the use of mother's own milk. For further information and to access all provider resources, including sample checklists, please visit chosencollaborative.org.